Drinking more than 67 ounces of sugary or artificially sweetened beverages a week may increase the risk of developing atrial fibrillation, an irregular heartbeat, but organic fruit juices without added sugar may decrease this risk, according to a new study. Our study's findings cannot definitively conclude that one beverage poses more health risk than another due to the complexity of our diets and because some people may drink more than one type of beverage, lead author and researchers at Shanghai Jiao Tong University School of Medicine in Shanghai, China Ningjian Wong said in a statement. However, based on these findings, we recommend that people reduce or even avoid artificially sweetened and sugar-sweetened beverages whenever possible. 3 to 6 million. That's how many people have atrial fibrillation in the United States, according to a separate AHA study. That number is expected to rise to between 6 and 16 million people by 2050. Though there isn't much research into the link between sugary drinks and atrial fibrillation, around 16% of participants who consume the artificial sweetener aspartame, often sold under the brand name Equal, experience heartbeat changes, according to a study published in the International Journal of Cardiology. There are several risk factors for atrial fibrillation, including obesity, diabetes, heart failure, moderate to heavy alcoholism, hyperthyroidism, chronic kidney disease and ischemic heart disease. However, the biggest factors are high blood pressure, which makes up around 1 in 5 cases, and advancing age. Although people of African descent are more susceptible to these risk factors, people of European background are more likely to have atrial fibrillation than any other group, though scientists aren't sure why, according to a JAMA Network Open study. Symptoms of atrial fibrillation include fatigue, dizziness, confusion, a fluttering or thumping sensation in the chest, a fast or irregular heartbeat, weakness, anxiety, shortness of breath and fatigue during exercise. Chest pain or pressure are also symptoms, but considered a medical emergency, according to the AHA. There have been conflicting studies conducted on the link between caffeine consumption and atrial fibrillation. The high amounts of caffeine in energy drinks, along with other ingredients like a type of amino acid called taurine that enhances caffeine's effects, increase atrial fibrillation risk, according to an American Society of Addiction case study. However, a 2019 AHA study found drinking between 1 and 3 cups of coffee a day had a slightly lower risk of developing atrial fibrillation compared to drinking 4 or more, or never drinking coffee. A separate study found that each cup of coffee drank a day reduced the risk of developing arrhythmia, an irregular heartbeat, by 3%. The American College of Cardiology believes daily consumption of up to 300 milligrams of caffeine should be safe for those with atrial fibrillation.